I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video edition, which is really important. It's on aesthetic versus cosmetic surgery. Because I work on the face, everyone asks, is it cosmetic? Even people that have problems that are incapacitating them ask them, is it cosmetic? I've even had patients after cancer surgery, their medical insurers would tell them it's cosmetic. So what is cosmetic? It's pretty straightforward. Cosmetic means superficial change. So if you've got a rundown house, you want to flog it off at market, you can do some superficial changes, it looks really great, you sell it. They're cosmetic changes on the surface. People do cosmetic surgery for all sorts of reasons, and yes, it extends to breast implantation and cheek implants and buttock implants and nose surgery, all that sort of stuff. It's a superficial change. Now, why you do it is a separate issue. We can talk about that for hours, but that's cosmetic surgery. Most of my work is in aesthetic surgery, and aesthesis is the value you place on something. So I give you a bottle of crap red wine and you look at it and taste it and go, that's terrible. Your value on that bottle of red wine is very minimal. The reason why we pay a lot for other red wines is because we place greater value on the taste. Well, aesthetic surgery is the value you place on an appearance. Everyone has different values they place on them, but in the face, there are three foundations for aesthesis. The first is getting rid of any excess. So if you've got droopy lids or drooping anywhere in your face, you want to get rid of that because that's aesthetically pleasing. The second is, of course, laxity, so stretching anywhere. You want to get rid of that. And the final one is asymmetry, one side different to the other. That's why if somebody has Bell's palsy, a face that is totally dropped from a nerve damage, it's unaesthetic. Aesthetic surgery for me encompasses a whole range. It might be functional from droopy eyelid skin or droopy eyelids, or functional because your lower eyelid is turned out. That's a functional problem. It might be a cancer problem. So we take a cancer out, you've got a hole. Now it's a reconstructive problem. Or it might be a rejuvenative problem. You just don't like your appearance. All of those fall under aesthetic surgery because the end result of any surgery on the face, doesn't matter what the cause, whether it's an injury or tumor or previous surgery gone wrong, the end result is to make it look good, to have the value of aesthesis, visual aesthesis, improved. I hope that all makes sense. Aesthetic versus cosmetic surgery is very, very important to understand, particularly on the eyes and face. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal and Oculoplastic Surgery. Thanks for watching.